the actual Americans are awakened. Now, I want to talk about healthcare and tort reform because I started it yesterday. No one else in the media seems to get it yet. They will very soon. And that's because the lawyers are running America, the American Trial Lawyers Association. If you look at the 1,000-page report on what they want to do with healthcare in this country, the Obamaites, most of whom are lawyers themselves, did you know that Kathleen Sebelius, the blonde lady, middle-aged, nice-looking blonde lady, she was actually the head of the Kansas Trial Lawyers Association for almost 10 years. They're in like moles into the Obama administration. It's estimated that $500 billion could be saved if defensive medicine were not practiced by doctors in America. I'll repeat the number, and I'll tell you what that is in a minute. If you've been to a doctor recently, he's probably ordered a test for you that you may or may not have needed, a CT scan, an MRI, ultrasound. He does it because he's afraid of a lawsuit from one of the leeches called trial lawyers who go after doctors for no reason in most cases. These tests could be cut back and save the healthcare system about $500 billion a year. I have not been able to find one page in the Obama plan that would rein in the lawyers. California has a limit of $250,000 on any lawsuit to do with medical liability. As a result, the vermin have left the state. The door slammed on their backsides as they ran to other states to ply their verminous trade. These lawyers are gone, by and large, from the state. Yes, they're still attacking companies that produce things, but they can't attack the doctors in the state the way they used to. Yet there's no such plan in the Obama administration. So I told you want to cut health care costs? Start with the lawyers. Cap medical liability claims. This is a good idea, isn't it? Anyone disagree with me? Tell me why. Now, I know one of the lawyers will call and tell me that's because what if a person, has an artery cut and dies? Is their life only worth $250,000? I'm sure I'll hear that. What wonderful work they do for humanity, the trial lawyers. But okay, we'll do that if you want. There's another way to save billions and billions of dollars a month. Cut off all medical care to illegal aliens. That's a no-brainer. They're not citizens. They're not entitled to it. Put a cop, a highway patrolman in every emergency room in America. No ticky, no laundry. No citizenship. Sorry, can't supply you with any free medical care. See, it's human nature to get care for free or get anything for free if it's out there. If you're going to go to, I'm going to give you an example. I'm going to give you an easy example. There's a farmer's market near me that I bicycle to every Wednesday, it appears. These are poor people trying to make a few cents. They're mainly Mexican people, some Indian people. They grow their own food. They make their own food. They set up a stand. They try to, how much can they make a day? $50, $100? I see liberal after liberal, the gray-haired ponytail left-wing vermin of Marin County. They go from stand to stand taking free samples. They go there and graze like the cheapskates that they are. They take a piece of a peach, then they take another piece of a peach, then they talk to the poor guy who is nice enough to talk to them, then they don't buy anything. Then they go to the Indian, they get a piece of cake for nothing. Come on, Molly, it's free stuff down there. It's the farmer's market, and we vote for Obama. Peace to everyone. Now, you see, there are cheapskates who will do this to a system. If it's free, they're going to take it for nothing. And most of them are liberals because it's against the credo of a real conservative to do this to a poor person. Let me tell you right now, I don't think a conservative would go stall to stall and rob food from poor people, which is what these libs do in Marin. So I have a plan, and it's related to the health care. What if it said samples 5 cents each? These cheap liberals wouldn't even pay a nickel for a piece of 5 cents I should pay for a piece of a peach? 5 cents I should pay for a piece of cake? 5 cents I should pay for a chip? They wouldn't pay it. They'd stop taking it for nothing. It's the same with your medical system. People are using the system and abusing the system because everything is free. I told you this yesterday. Make them copay $25 a visit. You don't like that? That's too high. Make them copay $10 a visit. You would cut down on the grazers. You'd cut down on the people who were doing it for sport. In 1981, I wrote a book called The Skeptical Nutritionist. It was published by Macmillan Publishing. And I coined a phrase called, recreational medicine. I used the phrase in my book, recreational medicine. And It was little accepted at the time. People didn't understand how far ahead of my time I was. But it's exactly what we have in America today. We have recreational medicine. And this is encouraged by many different forces in the country, primarily the drug industry. The pharmaceutical manufacturers encourage recreational medicine because each time one of these grifters goes to a doctor for free, Medicare, Medicaid, whatever, the doctor, to protect himself, practices defensive medicine and prescribes either a procedure or a prescription. And so it doesn't cost the doctor to do so, but he's got to do it to protect his back end from the lawyers. But the drug companies are all too happy to comply by giving another prescription, which is why most people over the age of 50 are on 6, 7, 8 medications. When I go in for a blood test or whatever, they say to me, routinely, blah, blah, blah. Okay, Michael Savage, blah, blah, how old are you, blah, blah. How many which medications are you on? And I say none. They always look up at me. They say none? How could that be? I said, well, I watch what I eat, I exercise, and I've taken vitamins all my life. So, and I've been lucky. Okay, I've been lucky. I told you, it's only tomorrow. Everything could change. I could be on 12 medicines tomorrow. I understand that. Things change. I'm not a fatalist in that regard, but all right. But what I'm saying is people are on a lot of drugs because the system wants them to be on a lot of drugs. But let's go back to the farmer's market analogy so you don't miss the main point. This is something even Democrats can follow and understand. You go to a farmer's market, you got poor people trying to sell a peach, a plum, a watermelon, a piece of bread, a cake that they made, whatever. And in order to encourage the people who come to the farmer's market to buy their product, they let them have a little sample for free. Most people will not take that sample for free and not buy something. Most will taste it and buy. But a large percent, let's say a small percentage, and I've watched them, they're usually older men with ponytails, who have Obama stickers on their brains. They go from stall to stall. That's a good peach. Where'd you grow it, Mr. Gonzalez? Well, that's great. I'll think about it. I'll be back. And Mr. Lib then goes to the Indian guy selling roti. Very good. How do you make it in your culture? Chomp, chomp. Can I have another piece? Chomp. And they go from stall to stall to stall. They eat a free lunch that way. Now, what if you charge that cheap liberal 5 cents a sample? Chances are he'd stop his behavior, wouldn't he? So now take my analogy and apply it to doctors. Charge him $10 a visit, $10 copayment. Make it $20 copayment. Make it $10 copayment. And a lot of the grifters would stop abusing the system. So I've given you 3 ways to save hundreds of billions of dollars a year. 1, first stop the torts. First introduce tort reform. Limit all medical liability lawsuits to $250,000 no matter what happens. That takes the psychos out of the system. And that takes the greed out of the system. That will save maybe $1 trillion a year. Now, where do I come up with $1 trillion a year? If doctors are practicing defensive medicine where they're ordering expensive MRIs, expensive ultrasounds, and such, and CT scans, for fear of a lawsuit, it's estimated that if we could stop the defensive medicine practices, we could save $500 billion. So that's $500 billion right there. Now put in place the other side of it. You start putting in place the no illegal aliens getting medical care in America, unless they pay for it. Make them pay cold cash. After all, they're sending $25 billion home to Mexico every year. Make them pay for the medical care. Let the hospitals and doctors get paid. I have no problem with them being treated. Let them pay for it the way I paid for it when I was young and poor. Let him pay for it the way my father paid for it when he got a heart attack and couldn't work anymore. It came out of his pocket in advance. I'll never forget. He had a heart attack. God rest his soul. He's laying in an oxygen tent. We didn't know if he would go minute to minute. It was frightening. So we go to the doctor, the great God. How is he? He says, well, it's like your father had a blowout. It's like a car had a blowout in a tire. Yes. Did you patch it? Well, we put a patch on the tire, but it could blow out again any minute. Thank you. I never slept again another night. I never had another night's sleep after that. But the fact is the doctor said it will cost you $100 a week for my continued care, meaning coming to the hospital once a day for 7 minutes. Now you say, well, what the hell is the big deal, $100 a week? Let me tell you what $5,000 a year was at that time. It was like maybe $50,000 a year today, $25,000, $30,000. I don't know what it is. $100 a week for a doctor to come to the bedside was a lot of money. But you know what? The family paid for it. We paid for it. He had put aside money for this day, for this rainy day. Did we like paying it? No. But we had to pay it, so we paid it. So why can't the immigrants from Mexico, El Salvador, Guatemala, Costa Rica, Belarus, Italy, and wherever they come from, why can't they pay for their medical care? I did, and I'm an American who was born here. So I've given you 3 different methods to cut down on health care costs that would save about $1 trillion a year. Have you heard one of these ideas discussed by these criminals called senators or congressmen? If you have, I'll tell you what, I'll eat my hat. I'll be right back.
Savage.